You may need a screening carotid ultrasound, either if your doctor found a bruit in your carotid, or if you're having TIAs or those mini strokes or any neurologic symptoms that cannot be explained, or if you're simply high risk for atherosclerotic disease, including having history of heart disease, having history of PAD, or having the usual suspects, smoking, high cholesterol, diabetes, hypertension, and so forth. Now, the good news is that treatment can prevent strokes, and it's well proven that it can do that. So what do you do if you find that you have carotid stenosis? Well, the first thing we have to do is to quantify the degree of stenosis. And that can be done with a simple ultrasound. We can simply measure the velocity inside the carotid artery, and that can tell us how significant the stenosis is. We can also measure in an MRI or a CT scan of the carotid arteries. Treatment is indicated if the degree of stenosis is more than 50% in patients that are having symptoms, or more than 70% in patients that are not having symptoms. And what are the treatment options? There are essentially two options to treat carotid disease. Carotid endarterectomy is a good surgical procedure, and it's well proven for many decades. But it involves getting a scar. There is a risk of nerve injury, and there is risks with the general anesthesia as well. Carotid endarterectomy may be contraindicated if the patient had prior neck surgery, or a history of radiation in the neck, or simply because the bifurcation of the carotid may be too high and may need dislocation of the jaw to do that. What's nice, and now we have a minimally invasive option, which is called carotid stenting. And that's a minimally invasive procedure that we insert a catheter through the groin or sometimes through the wrist. And we navigate that catheter using X-rays and fancy imaging into the carotid artery. And then we can put what's called a filter to prevent any of these clots or plaque dislodges to the brain and protects you from having a stroke during the procedure. We can then deploy a stent in the area, which is very effective in decreasing the risk of stroke and also has a very low chance of recurrent narrowing. It can be done in patients who had radiation or who had prior surgeries, and can even be done in patients that had a prior carotid endarterectomy. Both procedures have a risk of developing a stroke. So we really need to consider the risk of developing a stroke with the procedure versus the risk of developing a stroke without the procedure. And multiple studies have shown that if you meet criteria, the chances of having a stroke are certainly higher without the procedure than the chances of having a stroke during the procedure. You require to be on antiplatelet medications for at least 1 month, including aspirin and Plavix. In summary, carotid artery stenosis is one of the biggest causes of stroke. And the problem is, you don't know you have it until it's too late. So you should consider screening if you have risk factors.